You know, there are so many problems that we have with our bodies on a regular basis, and as we get older, we seem to have more problems. But there are some problems that can hit you young and old. And we come to see Dr. Sonia Spencer and find out some of the things that she can do to help you with those problems. And one of the main ones is headaches, migraines, and you see more and more of those nowadays, don't you? How are you doing, Doc? It's good to see you.
I'm doing great, Jim. It's great to see you too. And people are often surprised that one of the things that we treat most in the office are headaches and migraines because they don't naturally think about chiropractor or chiropractic care when they think about migraines and headaches. But that's one of the things that responds so well to chiropractic care. In fact, many of the people that come in here are mostly women who are suffering from the headaches and migraines. I have people in their 20s, 30s, 40s, on up. But surprisingly enough, many people report that they've had headaches all of their life.
And I know some people like that. You know, I know some people close to me that have suffered from migraines their entire life, and it's just really hard for them. They've tried all kinds of things to do, but yet they may not realize that, you know, there's so many things that your skeletal system and all your nervous system all comes together that can be helped out by seeing you.
Exactly, Jim. And everything starts with us with a thorough history on that patient. And one of the things we find when we sit down and talk to a person is they may not be associating with their headaches with what's causing them. And so we examine the neck and see where some of their problems may be coming from. And I'm going to kind of explain that to you today, what can cause some headaches, and tell you about some of the miraculous stories we've had with patients.
Oh, I know. We've spoken to a few of them in the past.
Yes.
I remember last year we spoke to a couple of people that had some headache problems and everything, and how coming to you has really, really helped them.
Exactly right. Well, Jim, it all starts with an examination, and when a person comes in with headaches, one of the things we want to look at is their neck. And you have several different nerves that come through the neck and about 7 layers of muscles on top of this, okay? And the nerve system up here is very, very delicate. And sometimes the vertebra can twist out of alignment, cause pressure on the nerves as they come out through here, or cause some irritation to the muscles, depending on if the spine is losing its proper shape and alignment, especially with people who are repetitively looking down, or if they're undergoing some type of stress in their body, like hormonal changes, or have something going on in their life. So when we look to the spine, to the cause of the headaches, sometimes we find a problem in the upper cervical that can really interfere with these nerves and cause chronic headaches. Many of these cases can have headaches over 50% of the month. Wow. Some of them so debilitating, Jim, that they're actually bedridden for days at a time with multiple over-the-counter and prescription medications, greatly reducing the quality of their life, even on the heaviest medications that are possible.
And the sad thing about that, Doc, is that medications and things like that, they're not going to solve the problem. They just mask the problem.
They just mask the problem.
They just hide, you know, the effects, so maybe you might get a little relief, but the issue is still there.
Right.
And you've got to get something done so it doesn't keep happening.
That's exactly right. So once we determine what the cause is of the person's headaches or migraines, which is usually some of these little vertebrae slipped out of place or rotated out of place, causing pressure on the nerve, we gently begin to realign them and retrain the muscles to relax and allow the nerves to flow through them so the person doesn't keep repeating the pattern. And in some of these severe cases, some of the things I hear is that I went from 15 migraines a month to no migraines.
Wow.
Or I've gone from 8 migraines a month down to 2 migraines a month. Or I'm able to get off of my medication now with no migraines. And some of the medications for migraines or headaches have tremendous side effects. You know, some of the over-the-counter medications really cause stomach upset, stomach bleeds, things of that nature if they're taken chronically. Some of the other prescription medications can cause numbness and tingling and problems with your thought processes.
Right.
So if people are on those long term, even if they're managing their migraines with them, like you said, they're not really correcting cause and maybe having some side effects that they want to eliminate, by finding out another course to treat these difficult migraines and headaches. Because one thing I want people to know is you don't have to live with headaches.
No.
It's not a normal part of life. And what I hear frequently from patients is coming here changed my life. It gave me my life back. It helped me reduce my medication. It helped me get off of my medication. I wish I'd have known about this 15 years earlier. Things like that. So I want to pass that on to patients who may be home suffering today, who maybe had to miss work today from a headache or migraine, and don't know what else to do.
And I think one of the other great things too is that you sit down and you talk to them. You do an evaluation with them, and they'll find out exactly what do you do. One thing: are you sitting at a computer all day long like this, or looking down, or your job has you, doing this all day long? Which is going to contribute to your problem. And I know that's one of the thorough questions whenever you sit down and talk to your patients, find out about them. So you say, well, you need to do this. Maybe you need to set that monitor up a little bit higher if you are on a computer every day, or make some adjustments that will, again, along with your treatment, is going to really alleviate that problem.
Yes, we help them make lifestyle changes. We help them correct their posture. We may give them some nutritional advice. A lot of times people with migraines or headaches or deficient in magnesium or other things, we really work on treating the whole person so that person can have a better quality of life in all areas all around. So it's really a problem that chiropractic care can help with. And it's something that we see phenomenal results with and help so many people with, change their lives, without drugs, without medications, without shots in the neck. So many people are coming in, they've been getting the shots for a number of years and maybe they used to work, but they're not working now, or they're tired of getting the injections. And I'm not anti-medicine at all, but if there is a non-invasive way to help yourself, if there's another way of helping yourself that's more natural without the side effects, chiropractic has no negative side effects, only positive side effects. It's the safest form of alternative care there is. In fact, it's safer than taking an aspirin. So
that's a good reason right there. If you'd like some more information, if you or someone you know or love is having problems with headaches, migraines, or anything, phone number's on your screen. She's located here right across from Pass Road Elementary in Gulfport. It's so good to see you again.
Good to see you too, Jim.
If you'd like to get some relief from your headaches or migraines, call Dr. Sonia Spencer.